Hello, my name is Dr. Rajna Ogrin. I'm Senior Research Fellow at the Bolton Clarke Research Institute, and I'm here today to talk about how to do research at Bolton Clarke and going over our research review and governance and committee processes. And this is on behalf of our Research Review and Governance Committee. Firstly, I'd like to acknowledge the traditional owners of the land on which we're meeting. We pay our respects to their elders past and present. So Bolton Clarke has a research institute which supports its staff to provide evidence-based care to our clients and residents, but also generating research to support appropriate translation of evidence into Bolton Clarke practice. There are 4 research priorities: optimising health and wellbeing, combating loneliness and social isolation, addressing mental health, and evaluating the implementation of assisting technology. All of the research undertaken at Bolton Clarke and within the Research Institute is informed by the data, includes co-design, thereby including all of the key stakeholders who will benefit from the research, also following robust design and methodological practices, as well as making sure that evidence is applied in practice. For any research to be undertaken at Bolton Clarke, we want it to be relevant to our communities, the staff, our organisation and the broader aged care industry as a whole. It needs to fill a gap within the existing research and knowledge base. The aim is to lead to positive change in care delivery. Ideally, Bolton Clarke Research Institute is engaged in the early stages of the research project development. The researchers in the institute understand how the care is delivered within aged care, so they understand how that research would best be applied. Also, we need to have the approval of any research from the Research Ethics Committee and the relevant Bolton Clarke stream business leader, which could be facilitated by the Research Institute to obtain. To ensure that the research does meet those requirements, there's a Research Review and Governance Committee that has a process which this flowchart outlines right here, and I'll go over this one at a time. The Research Review and Governance Committee team includes the Head of Research, the Human Research Ethics Committee Secretary, Research Review and Governance Committee Coordinator, and a rotating Research Institute team member. Now, the review by this team includes all projects that would need a Human Research Ethics Committee review and includes all Bolton Clarke Research Institute research, including grant submissions, invitations to be part of external-led grant submissions, and quality improvement versus research. Standardised documents are used, and the Research Review and Governance Committee Coordinator will provide them, although the documentation is available on the Research Institute website, and the link is right here. So basically the first port of call is an email to the research email that I've just listed through here. And firstly, the team from the committee will actually screen it. Now, the team would receive the first form of the Research Review and Governance Committee preliminary research form, so that the screening domains here were, as I listed earlier, that the research is relevant to our community, staff, organisation and broader aged care industry. It fills a gap in the existing research knowledge. There's engagement with the institute, and if it doesn't actually follow those things, then it likely would not proceed. Should the committee actually identify that yes, it does meet our inclusion criteria, then the committee would approach the business stream appropriate level at the at-home support, the retirement living or residential aged care where the research is aiming to be delivered and undertaken, and they would actually outline what the applicant would be seeking and what the resources would be needed in order to actually undertake that work. Therefore, the key people within the business stream would be able to see whether it is something that is possible and feasible to undertake within our organisation. What would then need to happen is that the Research Review and Governance Committee Coordinator would actually then, if there is approval from the business stream, would email the applicant and ask them to proceed to the next step and articulate what documents need to be provided for the next stage. If the applicant is not able to proceed, the coordinator will actually provide the reasons behind that. If this is a grant submission, then this is all the approval that's required, and no further submission of any additional documents are necessary. But those that are seeking to submit their proposal for the Human Research Ethics Committee would need to provide the additional documentation. So all preceding applicants would be asked to send all of the documents they would submit to the Human Research Ethics Committee for peer review by members of the Bolton Clarke Research Institute. In that way, information around significance, research quality, research team quality and capability, and domains of relevance to implement projects at Bolton Clarke would actually be reviewed in an objective way using guidance documents from the NHMRC and other scientifically rigorous approaches. So once the peer review has been done, the Research Review and Governance Committee Coordinator would collate the information and present the outcomes at the weekly meeting to discuss the peer reviewer recommendations. The possible outcomes are suitable to progress to the review to ethics with no or minimal changes. Amendments might be needed as advised by the reviewers and a re-review by the coordinator, or not suitable to progress for ethics review. If the actual applicant had requirements for amendments as suggested by the reviewers, then a response would be sought from the applicants, and applicant will be provided with that feedback and asked to resubmit if they did wish to proceed for ethics submission, and then the coordinator will review the response, and once all of the reviewer feedback has been addressed, the coordinator will present again back to the committee and articulate the next steps forward. Then if all of the documentation has been received and the committee are confident that all of the requirements have been met by the applicant, the next step is for the applicant to submit their documents to the Human Research Ethics Committee for their review of the ethical components of the project. Thank you very much. In this show I've covered what is needed to undertake research at Bolton Clarke. If you have any further information, please look at the website. Alternatively, email the research@boltonclarke.com.au. You can contact myself as the Research Review Governance Committee Coordinator, or Vicky Long as the Secretary of the Human Research Ethics Committee. Thank you.